The fluorescent lights hummed overhead like a swarm of insects trapped in glass. Hannah Clarke moved through the pediatric floor of Riverside Community Hospital with the kind of invisibility that only comes from 3 years of deliberately taking up less space than the air around her. She refilled 4 bags before the pump alarm sounded. She charted vital signs with precision that left no room for argument. She existed in the white spaces between the doctor's important decisions. They called her the janitor. The staff thought it was funny, a nickname whispered during rounds, repeated in the break room with the casual cruelty of people who'd never had to wonder if they belonged. Not because she cleaned floors. Because she moved through the hospital like she was sweeping away everyone else's mistakes, leaving nothing but order in her wake. Hannah had stopped correcting them 6 months ago. Correcting people required explaining yourself, and explaining yourself required being visible. She preferred invisible. The pediatric ward smelled like antiseptic and something underneath it, the particular staleness of a place where children cried and parents prayed and hope had a shelf life measured in hours. Her white sneakers squeaked against linoleum as she moved between patient rooms, her badge clipped precisely at shoulder height, her scrubs the same pale blue as everyone else's. Nothing distinguished her except the trauma shears hanging from her belt, the metal worn smooth from handling except for one small engraving along the blade that she kept angled away from direct light. Valkyrie. Just a nickname. Just a reminder of someone she used to be. The morning had started like every other morning. Report at 0630 hours, she still thought in military time, though she'd never said that aloud. Check the night shift notes. Review the 12 pediatric patients under her watch. Room 302, 7-year-old with pneumonia, improving on day 3 of antibiotics. Room 305, 5-year-old post-appendectomy, vital stable, advancing diet. Room 307, empty. Waiting. She moved with the terrifying fluid precision of someone who had performed chest compressions under mortar fire, though nothing in her movement suggested urgency. Just efficiency. Just competence. She adjusted the 4 rate on a sleeping 6-year-old with practiced fingers, checked the monitor, heart rate 98, oxygen saturation 97%, and made a note in the electronic chart. The notation was meticulous. The timestamp exact. The clinical assessment 3 sentences longer than any resident physician would have written. Dr. Michael Reeves, a second-year resident, passed her in the hallway. "Morning, Jan," he said, using the shortened version of the nickname without looking at her. She didn't correct him. "Good morning, Doctor." The break room was fluorescent white and smelled like old coffee and the chemical sweetness of artificial vanilla creamer. Hannah sat in the corner chair, always the corner chair, with her laptop open to the hospital's electronic medical records system. She was reviewing the chart for room 307, the empty room, preparing notes on the admission protocol for whoever would arrive next. Her fingers moved across the keyboard with the economy of motion that comes from doing something 1,000 times. The previous patient in 307 had been discharged 3 days ago. The room would be clean now. Sanitized. Ready. She didn't hear Dr. Marcus Hargrove enter. She heard his shoes first, expensive loafers, the kind that cost more than her monthly car payment, clicking against the linoleum with the rhythm of someone who walked everywhere expecting people to move out of his way. Then the sound of the refrigerator opening. Then silence. The silence lasted exactly 3 seconds. Hannah didn't look up from her screen. She knew what she would see if she did. She'd already learned this lesson 3 years ago, in the moment she'd corrected his dosage calculation during rounds. 1 milligram instead of 2. A simple error. The kind that killed people. She'd spoken quietly, barely audibly, just loud enough for the resident next to her to hear. The error had been corrected. The patient had been safe. Dr. Hargrove had never forgiven her. His voice came from behind her, the inflection of someone performing for an audience that wasn't there yet. "Still working on your little charts, I see." He'd opened a yogurt. She heard the spoon scraping the container. Must be nice to have so much free time. Hannah's jaw tightened imperceptibly. Her hands remained steady on the keyboard. She finished typing the sentence she was composing, a note about the previous patient's response to 4 fluids, precise and thorough and utterly professional, and then she closed her laptop. Slowly. Deliberately. The kind of calm that comes from having already survived the worst. She stood up, turned to face him with her expression perfectly neutral, and met his eyes. Dr. Hargrove was in his mid-50s, tall and angular, with the kind of jawline that could cut glass and the kind of smile that never quite reached his eyes. He wore a long white coat over navy scrubs, the fabric pristine, the stethoscope draped across his shoulders like a medal he'd earned through the sacrifice of his entire adult life. His gaze moved down her body, lingering on the trauma shears at her belt, and something flickered across his face, a tightening around the mouth, a narrowing of the eyes. "Room 307 will need prep for an admission," he said. "Not a request. An order. I'm expecting a pediatric case this afternoon. Complicated presentation. I'll want the best equipment available." "Of course, Doctor," Hannah said. She watched him turn away, his attention already moving past her, toward the coffee maker. He poured a cup with the kind of focus that suggested he was doing something important. The coffee was black. Strong. She could smell it from where she stood. 12 doctors have already seen this patient, he continued, his voice carrying the particular tone of someone delivering a monologue to an audience of 1. 12 different specialists. All of them competent. All of them thorough. He turned to look at her, the coffee cup held at chest height like a shield. "I don't expect someone at your level to understand the complexity of pediatric orthopedic cases, but I'll need you to stay out of the way when I'm examining the patient." "Understood." Hannah nodded. "Understood, Doctor." The words came out in her soft voice, the deferential one, the one that made her disappear even further into the background. She perfected this voice 3 years ago. It said yes while meaning nothing. It apologized without being wrong. It kept her employed. Dr. Hargrove left the break room, his loafers clicking against the floor in the distinctive rhythm. She watched him go, waited until the door closed behind him, and then she looked down at her hands. They were steady. Not trembling. Not shaking. Just hands. Hands that had held lives together through 3 tours in the Hindu Kush. Hands that had carried a 200-pound Navy SEAL through 12 kilometers of hostile territory with a sucking chest wound in his chest. Hands that had performed emergency procedures in places with names she'd been trained never to speak aloud. Hands that now refilled for bags and checked vital signs and wrote careful notes that no one would ever read as anything more than competent nursing. The trauma shears caught the light as she reached for her coffee cup. For just a moment, the engraving was visible. VALKYRIE. She turned the clip slightly, angling the shears away from direct sight, and drank her coffee black and strong while she waited for room 307 to need her. The clock on the break room wall showed 08 for 7 hours. This was Wednesday. This was ordinary. This was the kind of morning that happened every day in every hospital in America, where invisible people did precise work and important people ordered them around and nobody knew anyone was about to change everything. Hannah sat alone in the fluorescent white, her hands perfectly steady, her face a mask of professional composure, and waited for the child who would bring the Navy SEAL, who would bring the Pentagon, who would bring the general, who would bring the truth that she'd spent 3 years trying to keep buried under 3 years of invisibility. What happened in room 307 would not just end a doctor's career. It would bring the entire hospital to its knees. The first humiliation came during grand rounds on Tuesday morning. Dr. Hargrove stood before 15 doctors and residents, Hannah's patient chart held like evidence in a prosecution. His voice carried the particular cruelty of a man secure in his dominance. "This is what happens when nurses forget they're not physicians," he announced, the words landing with theatrical precision. He opened the chart, reading Hannah's notes aloud in a mocking falsetto that made the residents shift with uncomfortable laughter. "Patient presents with tachycardia and decreased capillary refill. Recommend immediate vascular consult." He paused. The pause was deliberate. Apparently Nurse Clarke here thinks she can diagnose compartment syndrome from across the room. The laughter came obediently. 15 doctors, trained to recognize competence, chose instead to mirror their superiors' contempt. Hannah stood against the back wall, her shoulders straight, her breathing unchanged. Her jaw clenched once, a single moment of visible tension, then her face returned to its neutral mask. Professional composure. The kind that comes from years of keeping secrets. Her hands remained steady at her sides. Credential-less competence, Hargrove continued, turning to address the gathered physicians like he'd discovered something profound. That's the real danger in modern medicine. Not the knowledge gap. The confidence gap. The person who doesn't know what they don't know. He looked directly at Hannah. And thinks they can teach others. She didn't flinch. Didn't blink. The fluorescent lights overhead cast everything in that hospital pallor, white walls, white coats, the kind of sterile brightness that made everyone look slightly bloodless. Hannah's scrubs were the same blue as a dozen other nurses, her badge clipped to her waistband, her name embroidered small enough to miss if you weren't looking. That was the point of a uniform. It made you invisible. Hargrove was still talking. His voice had that particular timbre of someone who'd never been told no by anyone who mattered. A tank idling in a garage, all power, no forward motion. He closed the chart with deliberate finality, a sound like a weapon being holstered. "Thank you for the teaching moment, Nurse Clarke," he said, and the sarcasm hung in the air like something visible, like you could reach out and touch the contempt. Hannah waited until the group dispersed. She waited until Hargrove had moved on to examine a patient 3 rooms down. Then she stepped away from the wall and returned to her work without acknowledgement, without anger showing on her face, without the smallest indication that anything had penetrated the surface. The second attack came 3 days later. The break room smelled of stale coffee and desperation, the particular funk of fluorescent-lit spaces where people tried to rest and failed. Hannah stood at the vending machine on Thursday afternoon, her shift ending in 2 hours, her hands moving with the muscle memory of someone who'd done this 1,000 times. Insert quarters. Press B7. Watch the metal spiral slowly rotate and release her coffee. Hargrove's voice carried across the room like an announcement. Like a public execution. "You know what your problem is, Clarke." He was loud enough that everyone could hear. The break room had 6 people in it. 5 of them stopped moving. "You military nurses come in here thinking combat medic training makes you qualified for real medicine. News flash, it doesn't." Hannah's fingers tightened around her coffee cup. 1 second. 2. Then she released the tension consciously, the way you'd set down something fragile. "Maybe you should consider a career change," Hargrove continued, his voice climbing with the pleasure of an audience. "I hear the VA is always hiring. Janitors. That might be more your speed." Laughter rippled through the break room. The kind of laughter that was less about humor and more about tribal alignment, the other staff members choosing their side, choosing safety over solidarity. Hargrove was the attending physician. He signed the paychecks. He controlled access to desirable shifts and patient assignments and professional recommendations. Of course they laughed. Hannah turned slowly. Her eyes met Hargrove's for exactly 2 seconds. In those 2 seconds, something flashed across her face, not anger, not pain, but something deeper. Recognition, maybe. The kind that comes from seeing someone clearly and understanding exactly what they were made of. Then she walked out without a word. Not a response. Not a comeback. Nothing that could be used against her later. Nothing that would give him ammunition. She simply held her coffee and moved toward the door with the kind of calm that comes from having already survived the worst. The third incident happened during a code. The patient was an elderly man, post-operative, his vitals deteriorating with the speed that made time seem to compress. The monitor showed the kind of rhythm that demanded immediate intervention. Hannah was running fluids when Hargrove's voice cut across the controlled chaos of the resuscitation. "Push 1 of epi, push 2 of atropine," he ordered. Hannah looked at the patient's weight on the chart. 60 kilograms. The math was automatic, neural pathways carved by thousands of hours of trauma work. A senior chief petty officer learns dosage calculations the way other people learn to breathe. 2.4 milligrams, she said quietly. The patient weighs 60 kilos. The room went silent. Not the silence of confusion, but the silence of recognition. A nurse, a female nurse, a blue-scrubbed nobody, had just corrected the attending physician. In front of a resident. In the middle of a code. Hargrove's face flushed crimson. The color started at his neck and spread upward like a tide. He didn't correct his order. He didn't acknowledge the error. Instead, he watched Hannah administer the accurate dosage while the monitor began its climb. Heart rate stabilizing. O2 saturation climbing. 78. 85. 92. The patient's rhythm returned to something the heart recognized as home. The patient stabilized. The crisis passed. And Hargrove's humiliation was complete. Afterward, he cornered her in the medication room. The space was narrow, shelves on both sides, fluorescent light harsh as an interrogation room. Hannah was restocking syringes when she heard his voice, low and controlled and far more dangerous than the public mockery. "You embarrass me in there, Clarke," he said. His hand gripped the door frame. In front of a resident. "That was a mistake you're going to regret." Hannah didn't turn around. She continued placing syringes in their designated slots with the same focus she'd brought to every task. When she finally spoke, her voice was quiet, professional, the voice of someone making a report. "The patient's weight was 60 kilograms, she said. The dose was incorrect." "I don't care if it was a unicorn," Hargrove said. "You don't correct me. Not in front of anyone. Especially not in front of residents." He pulled out his phone. "I'm calling administration." Hannah turned to face him then. Just turned, unhurried, and looked at him with eyes that had seen things he couldn't imagine. She didn't speak. The silence was so thick you could operate in it. It lasted exactly 3 seconds. Then she nodded once and walked past him, out of the medication room, back to her patients. That night, Hannah sat alone in her apartment. The place was sparse, functional, the way military housing learned to be. No pictures on the walls. No decorations. Just the essentials, a bed, a chair, a small kitchen where she made coffee she drank alone. She sat with that coffee growing cold in her hands, staring at a photograph she kept in a frame on her nightstand. A bearded man in desert camouflage, his jaw set like a decision that couldn't be unmade. On his forearm, visible in the picture, was a tattoo in bold letters, Clarke. Petty Officer Jake Morrison. 8 years ago. The Hindu Kush Mountains. A mission that wasn't supposed to exist. 3 kilometers through hostile territory with a man bleeding out from a sucking chest wound, his lungs filling with blood, his eyes already starting to glaze. She'd carried him the way you carry something irreplaceable. Her hand steady. Her mind calculating survival odds and rejecting them all. She'd stayed anonymous. Insisted on it. Not for security, she'd done enough operations to know that security was a myth. But because some people deserve to live their lives without carrying the weight of knowing who'd saved them. Some people deserve to be whole. She'd learned his name later, through channels that didn't officially exist. She'd learned he'd made it home. That he'd gotten married. That he'd had a daughter. She'd tried not to think about him after that. Now, in the gathering dark of her apartment, Hannah Clarke held the photograph and waited for sleep that wouldn't come. Outside, the city moved through its evening, people heading home, leaving their work behind, their identities intact and unquestioned. She sipped her cold coffee and said nothing to the empty room. There was nothing left to say. She'd made her choices. She'd walked away from one life, tried to build another, and pretended that a nurse's uniform could contain what she was. It was a good pretense. It had lasted 3 years. But the woman in the photograph, the one with eyes like storm-dark water and hands that had held lives together, knew that pretenses always cracked eventually. Someone always looked too closely. Someone always asked the right question. Someone always recognized the truth beneath the surface, the way a predator recognizes another predator, even wearing different skin. The waiting, she understood, wasn't infinite. The waiting was just borrowed time. The waiting, she understood, wasn't infinite. The waiting was just borrowed time. That understanding settled into Hannah's bones as she watched the clock on the pediatric ward tick toward 3 in the afternoon, her hand steady as she pulled Lily Morrison's chart from the rack outside room 307. 8-year-old. Admitted 72 hours ago. Pain in the left calf, escalating. The note started clinical and grew increasingly dismissive as they descended through the chart, 15 different physician signatures, 15 different dismissals. Growing pains. Anxiety-driven somatic complaint. Possible conversion disorder. One attending had even written rule out malingering for parental attention with a confidence that made Hannah's jaw clench, though her face remained composed as stone. She knocked once and entered the room where Jake Morrison sat rigid in the visitor's chair, his massive frame folded into furniture built for smaller people, and his daughter lay curled on the hospital bed in a way that children in genuine pain contort themselves, not the performed position of someone seeking attention, but the desperate geometry of someone trying to outrun their own body. Lily's leg was swollen. Not the subtle swelling of inflammation. The kind of swelling that stretched the skin tight and mottled it purple and white like marble left in the rain. Hannah had seen tissue in distress before. She'd seen it in the field, in the Hindu Kush, when the blast radius extended into tissue and the cascade of cellular destruction began its countdown. Different context. Same language. Pain was information, and this child's leg was screaming. "Lily, I'm Hannah," she said, her voice dropping into the register she used for kids in real crisis, calm as a held breath, no inflection that suggested fear. "I need to check your foot. This okay?" The girl nodded, her lip trembling. Jake leaned forward, his shoulders tensing with the particular desperation of a father watching his child suffer and being told repeatedly that nothing was wrong. His forearm bore the tattoo, Clarke in thick block letters, faded from years of sun and salt water and the specific wear of someone who'd carried that name through impossible terrain. Hannah's hands moved through the examination with the precision of someone who'd performed them thousands of times. She pressed the child's calf gently, noting the firmness beneath the skin, not pitting edema, not fluid accumulation, but the rigid swelling of tissue being compressed by muscle that was swelling within its own inelastic compartment. She palpated down toward the ankle, checking the dorsalis pedis pulse, the small artery on top of the foot that should thump against her fingertips like a compass needle finding north. Nothing. The pulse was absent. Completely absent. The room's fluorescent light hummed its mechanical song, indifferent to the fact that Hannah was looking at compartment syndrome in textbook presentation. Compartment syndrome, when muscle swelled within its fascial sheath and blood flow was compressed, when tissue began its slow death from hypoxia, when the window for intervention narrowed like an hourglass measured in hours instead of days. 15 doctors had looked at this child and documented growing pains. 15. And none of them had checked for a dorsalis pedis pulse, or if they had, they hadn't understood what its absence meant. "I'm going to call your doctors," Hannah said to Lily, her voice still level, still composed. "We're going to get you feeling better. Okay?" She straightened, moving to the doorway with the kind of controlled speed that didn't alarm the child but communicated urgency to anyone who understood the language. She found the nearest phone at the nurse's station and paged Dr. Hargrove. The response came back 4 minutes later. He was busy, he'd call back. Hannah waited 2 minutes and paged again. This time no response at all. She paged a third time, and on the third contact, she called the OR directly, her voice pitched low and professional. "This is Hannah Clarke, pediatric nurse, room 307. I need to speak to the vascular surgeon about an 8-year-old with absent dorsalis pedis pulse and clinical compartment syndrome. What's the next available surgical suite?" The OR coordinator on the other end of the line checked the schedule, and Hannah heard the answer that made her close her eyes for a single breath. 90 minutes. The vascular surgeon was already in theatre. 90 minutes minimum before an operating room would be available. 90 minutes. In the Hindu Kush, 90 minutes was how long it took for a casualty with severe hemorrhage to circle the drain if you didn't intervene. In a child's leg with compartment syndrome, 90 minutes was the difference between amputation and function. The tissue was dying by the minute. Each minute that passed was muscle turning to necrotic waste, irreversible destruction spreading through the fascial compartment like a flame moving through dry grass. Hannah called back to room 307, where Lily's screams had moved into a higher register, pain that was no longer containable, pain that had exhausted the child's ability to cope and was now manifesting as pure animal sound. The sound of a body in genuine distress, the kind of scream that made the hindbrain light up with warnings, that moved something primal in anyone who heard it. Jake Morrison came into the hallway, and he was no longer the controlled father in the visitor's chair. He was a Navy SEAL watching his child suffer, and the two identities collided in his face with visible force. "What's wrong? What's happening to her?" His voice carried the specific timbre of command even in desperation, the voice of someone accustomed to having people listen. Hannah's composure held like reinforced concrete. "Your daughter has compartment syndrome," she said. "It's a medical emergency. Her calf muscle is swelling inside its own sheath, compressing blood flow. If we don't intervene surgically within the next few hours, the tissue dies. She loses the leg." Jake's face went blank, that specific kind of blank that meant his tactical brain was engaging, processing threat assessment and response protocols. "How long?" he asked. "Not long enough," Hannah replied. She could feel him calculating, running the numbers the same way she was. "I'm contacting Dr. Hargrove now. We need surgical authorization." When Hargrove finally called back, it took him less than 30 seconds to deliver the response that confirmed what Hannah had already suspected. His voice came through the phone smooth as oil, satisfied in a way that made her stomach recognize the trap before her conscious mind did. "Nurse Clarke, I've reviewed the chart thoroughly," he said, and there was something almost musical in his tone, the sound of a man who'd been waiting for exactly this moment. "This patient has been evaluated by 15 different physicians over 2 weeks. Every one of them has documented and ruled out surgical pathology. I'm not about to authorize an emergency procedure based on a nursing assessment. You will continue routine monitoring and we'll reassess in the morning. Is that clear?" Hannah's jaw clenched so hard she could feel her molars flex. In the background of room 307, Lily's screams had evolved into something that wasn't quite human anymore, the sound of a child's pain breaking past the boundaries of what her small body could contain. "Doctor, with respect, compartment syndrome is time-sensitive. This child will lose her leg by morning if we don't." "Then I suggest you document your clinical concerns in the patient chart and let the physicians make medical decisions," Hargrove interrupted, his voice dropping into the register he saved for nurses he wanted to break. "And Clarke? If you even think about overstepping your scope of practice, about performing any procedure without explicit physician authorization, I will have security escort you out of this hospital before you can blink. I will file a complaint with the state nursing board. I will ensure that your name becomes synonymous with reckless endangerment. Are we completely clear?" The line went dead. Hannah stood in the hallway outside room 307, where Lily's screams had reached a pitch that made the other nurses on the floor turn away, made the monitors seem to pulse in sympathy. She looked down at her hands. Steady. Not trembling. The hands of someone who'd performed surgery in the backs of helicopters with rounds impacting the fuselage, who'd held the carotid artery of a dying SEAL while the medic worked the rest of the body, who'd understood in her bones that some patients were past saving and some patients were still clinging to life by a thread you could feel pulse against your fingertips. She looked down at her belt. The trauma shears hung there in their worn leather holster, the one she'd carried through 3 tours, the one she'd used to cut through tactical gear and synthetic mesh, and once, in the Hindu Kush with rounds coming in from the eastern ridge, the one she'd used to perform an emergency fasciotomy in a Taliban compound basement with nothing but a penlight and the knowledge that the alternative was a dead SEAL operator. The ones engraved with VALKYRIE. She walked back into room 307, locked the door behind her, and unclipped the shears. Jake Morrison looked up from his daughter's bedside, something flickering across his face, recognition of the gesture, perhaps, or understanding of what those shears had always meant, what they meant now. "Your daughter is 8 years old," Hannah said, her voice dropping into a register that was no longer deferential. The mask slipped like water. "If I don't intervene in the next few minutes, she will lose her leg. I am a senior chief petty officer in the United States Navy. I have performed this procedure in combat conditions on soldiers whose names I never learned. I am not asking for permission. I am telling you what happens next. Understood?" Jake's eyes met hers for the first time, and she saw the moment he understood. Saw the moment her face resolved into something familiar, something he'd thought he'd never see again. The shears caught the fluorescent light as she turned toward the bed, where Lily's scream seemed to be the only sound in a world that had contracted down to this moment, this room, this child, and the person who understood without question what the cost of inaction was. What happened next didn't just silence the room. It changed everything. Lily Morrison's screams had stopped being a call for help somewhere around hour 4. Now they were just screams, the sound of a child's body telling her that something inside was dying. The pulse in her left foot had vanished an hour ago. Hannah Clarke knew what that meant. Tissue death. Irreversible. And 15 specialists had missed it completely. She stood at the nurse's station with Lily's chart in her hands, reading vital signs that told a story the doctors couldn't see. Compartment pressure rising. Mottled skin darkening to purple. Dorsalis pedis pulse absent. Anterior tibial artery compromised. The child had maybe 90 minutes before the muscle tissue in that calf began to necrose beyond repair. Hannah paged Dr. Hargrove. No response. She paged again at 14:32. Silence. She paged a third time at 14:06, and the charge nurse looked at her with the kind of exhaustion that came from watching a pediatric patient suffer for 14 days without answers. "He's in clinic. Non-emergency. He won't break away." Hannah's jaw tightened imperceptibly. She moved to the phone on the wall and called the OR directly, her voice steady as river stone. "This is Hannah Clarke, RN, room 307. I need the next available surgical suite for emergency fasciotomy." The scheduling coordinator's voice crackled back, "Fastest we can turn over is 90 minutes. Next available slot. 90 minutes. Lily Morrison had maybe 70. Hannah replaced the phone with the precision of someone placing a loaded weapon on a table. She walked to room 307 where Jake Morrison sat with his daughter's small hand gripped in both of his, the child's leg swollen to twice its normal size, skin the color of an old bruise. Jake looked up with the hollow eyes of a man whose SEAL training had taught him to handle anything except the suffering of his own child. "I'm going to help her," Hannah said. It wasn't a question. It wasn't a request. The clipped cadence of her words, the same rhythm used in combat briefings and extraction operations, made something in Jake's nervous system snap to attention. He'd heard that voice before, in different uniforms, across different continents. A voice that meant someone was taking control. "What are you going to do?" he asked. "Compartment syndrome. Fascia is compressing the arterial supply. Her leg dies in 60 minutes if we don't relieve the pressure." Hannah was already pulling the privacy curtain around the bed. "I need you to hold her hand. Keep her focused on your face. Do not let her look at the leg. Do not tell her it's going to be okay. Tell her the truth, that her dad is right here and you've faced worse. Do you understand?" "Yes." The words came automatically. Muscle memory of rank, of deference, of someone who'd learned in the Hindu Kush that when that voice gave orders, you followed them without question. Hannah opened her supply cart and withdrew the trauma shears from the front pocket of her scrubs, the ones engraved with VALKYRIE on the blade in letters so small only the person holding them would ever see them. She'd carried these same shears through 3 deployments. She'd used them to cut through uniforms and body armor and the barriers between life and catastrophic bleeding. She'd never used them in a pediatric room at Riverside Community, but the principle was the same. Pain was information. The skin opened under the blade, a clean line over the anterior compartment, 15 centimeters from knee to mid-calf. Lily screamed, the sound raw and primal, but Jake's voice cut through it. "I'm here. I'm here. Look at me. Just look at me. His Navy SEAL training was showing now, the framework of his voice steady even as tears streamed down his face. The fascia beneath the skin was tight as a drum, bulging outward as if the compartment inside might burst. Hannah made the second incision through the glistening white tissue, and the pressure released with a sound like tearing fabric, a hiss of air that had nowhere else to go. Lily's scream softened immediately as the compression on her arterial supply eased. Irrigation, Hannah barked to the charge nurse who'd followed her in, her voice the texture of command. Saline, gauze, suture kit. Now. The nurse moved. No questions. No hesitation. There was something in Hannah's presence that overrode the normal protocols, some quality that made people respond with the automatic obedience usually reserved for senior officers. She was already palliating the compartment borders, assessing tissue viability, her hands moving with the kind of fluid precision that came from having done this in field conditions where the margin between saving a limb and losing it was measured in minutes. She started suturing at 14:58. Simple interrupted stitches, secure but not perfectionist, the priority was closure and getting the leg elevated. Lily's breathing was settling now, the screams tapering to whimpers. Hannah was halfway through the fourth suture when the door opened. Dr. Hargrove stood in the doorway for exactly 2 seconds before the scene registered. The open surgical field. The beaded blood. The trauma shears in Hannah's hands. The child on the bed with her calf partially open and being actively sutured by a nurse who had no surgical credentials, no board authorization, no right to be performing this procedure in his hospital. His face transformed. The color rose from his collar like mercury climbing a thermometer, and his mouth opened the way it did when he was about to deliver one of his public corrections, those moments when he needed everyone nearby to understand the supremacy of his credentials. What the hell do you think you're doing? His voice pitched upward at the end, outrage and vindication twisting together. You're performing surgery without authorization. Security. I need security in here. Hannah tied off the final suture without looking up. Her hands didn't shake. Her voice didn't waver. She said only, saving her leg. Hargrove pulled his phone from his pocket with the jerky movements of someone running on pure adrenaline and rage. He was already dialing before he finished speaking. This is Dr. Marcus Hargrove. I'm at Riverside Community, room 307. We have a rogue nurse performing an authorized surgical procedure. I want her credentials suspended immediately. His voice dropped into the formal register he used with administrators. I'm calling the state nursing board next. This is criminal negligence masked as heroism. By the time Hannah completed the suture line and applied the sterile dressing, hospital security was waiting outside the room with a cardboard box and a manila folder. The security guard, a young man named Patterson who'd watched Hannah help his wife through a postpartum hemorrhage 3 years earlier, wouldn't meet her eyes as he handed her the folder. I'm sorry, Patterson said quietly. Inside the folder, termination paperwork. Effective immediately. Cause, performing medical procedures outside scope of practice. Unauthorized surgery. Violation of state nursing regulations. Dr. Hargrove's signature was already there, pre-signed as though he'd been preparing this moment since the day she'd corrected his calculation in front of the resident. Hargrove's voice carried down the hallway as Hannah collected the box, his volume pitched for maximum audience. Reckless cowboys who think combat medic training trumps medical school have no place in this hospital. This is exactly what happens when we blur the lines between professional medicine and amateur heroics. Hannah said nothing. She walked to her locker, changed out of her scrubs, placed the trauma shears carefully in the box on top of her personal items, the photograph of Jake Morrison that she kept hidden in the back, the commendation letter from a SEAL command dated 2015 that she'd never framed, the unit coin from her deployment that weighed exactly 2 ounces and carried the weight of 47 lives. She closed the box. She clocked out. She drove to the 24-hour diner off Academy Boulevard and sat in a corner booth with her hands wrapped around a coffee cup that grew cold as the evening darkened outside. The reflection in the diner window showed a woman in her late 40s with gray beginning at the temples and scars on her knuckles that she'd learned to explain away as old injuries from before she came to Colorado. A woman who'd walked away from everything, the rank, the authority, the identity, and built something quiet instead. A woman who'd saved Lily Morrison's leg and lost her job in exactly the same 18-minute span. She thought about Jake Morrison's face when he'd recognized something in her voice, in her movements, in the way she issued commands that made him snap to attention like a recruit instead of a grieving father. She thought about the trauma shears in the box, with their engraved call sign that she'd carried through 3 continents and 14 years of trying to disappear. The coffee had gone cold. The diner was empty except for the waitress, a woman named Sandra who always refilled without asking and never pried. Hannah sat in the fluorescent wash of the booth light and wondered if she'd finally paid the price for thinking she could bury who she'd been. The next morning would bring complications she couldn't yet see. The next week would bring consequences she'd already begun calculating. But in that moment, at 3:08 a.m. in a diner on the south side of Colorado Springs, Hannah Clarke sat with her hands folded on top of the table and stared at her own ghost in the window, wondering what happened when the thing you'd spent 2 decades running from finally caught up with you on a Tuesday afternoon in a pediatric hospital room, and you chose to stop running and stand your ground instead. The coffee had gone cold an hour ago. Hannah sat in an empty diner on the south side of Colorado Springs, her hands folded on the Formica table, watching her own ghost reflected in the darkened window. 3 a.m. The world outside was cement and sodium lights and the particular silence that only comes when everyone else is sleeping. She'd been fired for 6 hours. She'd been unemployed for 6 hours and 43 minutes. The scrubs were still in her car, she couldn't bring herself to change. Some part of her still believed she'd wake up and this would be practice, another scenario to survive, another test to pass. But 8-year-old Lily Morrison was sleeping with 2 functioning legs in room 307 at Riverside Community, and that was real. That was the thing Hannah had chosen. That was the choice that had cost her everything she'd built in the civilian world. 22 years of quiet. 22 years of being just a nurse. 22 years of running from the woman she'd been in the Hindu Kush Mountains, and it had taken 8 minutes of scalpel work and compartment pressure release and the muscle memory of emergency surgery to blow that entire fabrication apart. She raised the coffee cup to her lips. The liquid inside was the color of motor oil and tasted like giving up. The diner's front door chimed. A trucker came in, ordered coffee, sat 3 booths away without looking at her. Hannah was grateful for the company that wasn't company, for the sound of someone else existing in the same space. The diner's fluorescent lights buzzed overhead like insects, casting everything in that particular shade of harsh white that made you look like a corpse. She wondered if Dr. Hargrove was awake. She wondered if he was sleeping soundly or if he understood yet what he'd set in motion. The thought arrived like recognition, he has no idea. Jake Morrison was awake too. He stood in the Riverside Community lobby at 6 in the morning with his hands in his pockets and his jaw clenched tight enough to fracture bone. Lily was stable. 2 surgical teams had verified the fasciotomy had been textbook, had saved the limb, had been performed by someone who knew exactly what she was doing. A nurse. An ordinary pediatric nurse with trauma shears engraved with a military call sign. He'd held those shears in the recovery room while Lily slept off the anesthesia, studying the engraving the way an archaeologist studies an artifact. VALKYRIE. His blood had gone cold reading that word because he knew that word. Everyone in SEAL Team 3 knew that word. VALKYRIE was a call sign. VALKYRIE was a legend who'd gone quiet 8 years ago. VALKYRIE was a senior chief petty officer who'd disappeared from active duty records without explanation. He spotted a Marine colonel in the lobby, visiting his brother on the 3rd floor, someone he'd served with in 2009. Their eyes met. Jake crossed the space between them and leaned in close enough that only the colonel heard his next words. "VALKYRIE's alive." The Marine colonel's face went absolutely white. He'd been on 3 of those operations. He'd seen what VALKYRIE could do. His hand shook as he pulled out his phone and dialed a number he'd never expected to need again. "Sir, we have a situation at Riverside Community Hospital in Colorado Springs." "No, sir, not a threat situation. A recovery situation. You need to hear this." The two-star general arrived before noon. His convoy, 2 black SUVs, crisp uniforms, the particular energy of someone accustomed to absolute obedience, pulled up to the hospital's main entrance while Dr. Hargrove was walking into the board meeting that would officially recommend license revocation. The general moved through the corridors with the kind of assured stride that made staff part like water. He entered the conference room mid-sentence, mid-vote, his presence filling the space like he'd displaced all the air. Hargrove's face went the color of old newspaper. The board chairman stood. "General, we weren't expecting, I'm aware." "Stand down." The general sat across from Hargrove and placed a shadow box on the table between them. Inside, arranged on blue velvet, a navy cross. 2 silver stars. A purple heart. "Do you know what these are, Dr. Hargrove?" Hargrove's mouth opened. Nothing came out. "Those are the decorations of Senior Chief Petty Officer Hannah Clarke. She received them for extraordinary heroism during combat operations in the Hindu Kush Mountains in 2015 and 2016. She carried 3 wounded operators through enemy fire across 12 kilometers of hostile territory in a single night. The Navy Cross is the highest peacetime military decoration." The general began to raise a salute to the medals, and Hargrove's voice cracked like breaking ice. "That's stolen valor. There's no such person. That's a fabrication designed to..." The general opened a classified file. His finger traced the document. He began to read. "After Action Report, Operation Mountain Reach, date stamped June 2015. Senior Chief Clarke rescued 2 Delta operators and 1 SEAL with critical injuries. Both Delta operators survived because of her intervention. She performed emergency hemostasis, airway management, and casualty transport under active fire. No casualties on her team. 6 months later, Operation Shadow Ridge. 3 Navy SEALs, all critical. Senior Chief Clarke," the general looked up. "Senior Chief Clarke saved every single one of them. 47 lives in theater, Dr. Hargrove. 47. One of them had a daughter. That daughter was in room 307 when you decided a nurse who'd corrected your dosage calculation deserved to lose her career. The silence in the room was so thick you could hear the ventilation system breathing. By that afternoon, everything unraveled. A nurse named Patricia had filmed Hargrove's vending machine mockery 2 days earlier. The words military nurses should consider a career change, maybe the VA is hiring janitors, and posted it with a caption, "This doctor mocked a Navy Cross recipient before she saved a child's leg." 20,000 shares within 6 hours. 50,000 by evening. The video reached Dr. Sarah Chen in Boston, Hargrove's medical school mentor and a Navy veteran herself, and she called the board chairman with barely controlled fury in her voice. "Marcus was my student. I recommended him to Riverside. And now I'm watching him mock a decorated combat veteran on the internet. Pull his privileges today. I'll make sure the state board hears about this. Every hospital in Colorado Springs will hear about this." The board convened an emergency session. Hargrove's carefully cultivated network of favors, the board members he'd cultivated, the references he'd counted on, the political capital he'd spent a decade accumulating, evaporated like morning fog. The state medical board opened a formal investigation. 3 hospitals quietly revoked his credentials. His wife left a voicemail on his phone. "I saw the video. Don't come home." By the end of that week, the only position Marcus Hargrove could secure was janitorial staff at the Colorado Springs VA hospital. Mopping floors. In the same building where veterans received care. On his first day, he pushed his mop cart past a room where 3 Navy SEALs were visiting a wounded teammate. One of them looked up, recognized Hargrove's face from the viral video, and turned his back. The others followed in sequence, a synchronized movement that communicated everything Hargrove needed to know about what he'd become. A ghost. An invisible man haunting a building full of people who knew exactly who he was and what he'd done. But that wasn't the worst part for Hargrove. The worst part was that he'd watched it happen. He'd watched his career disintegrate in real time, watched his network collapse, watched his wife's car pull away from their driveway with the brake lights disappearing around the corner. He'd watched his status, the thing he'd built his entire identity around, transform into liability. And he understood, in the particular way that broken people understand things, that he'd brought every bit of it down himself. He'd chosen to mock her. He'd chosen to escalate. He'd chosen to pick a fight with someone who'd already survived the worst humanity could offer, and she'd simply let him destroy himself while she went about the work of saving lives. Hannah stood in Lily Morrison's room that evening, watching the girl sleep with color returning to her cheeks. The fasciotomy incision was clean. The tissue perfusion was restored. The leg was saved. Jake sat beside the bed holding his daughter's hand, and when he finally looked up, his eyes caught on the trauma shears clipped to Hannah's belt. He stood slowly, moving closer, reading the engraving he'd never seen in full clarity. Valkyrie. His hand rose automatically to his own forearm, to the tattoo that read Clarke in bold military letters. Recognition flooded his face like a door opening. The hand that had carried him 3 miles through the Hindu Kush. The voice that had whispered, "Stay with me, petty officer, stay conscious," when his lung was collapsing. The woman who'd disappeared into the mountains and didn't resurface until she was kneeling beside his daughter with a pair of trauma shears steady as surgical steel. Tears streamed down his face as he stepped forward. "It was you," he whispered. 8 years. I've been looking for you for 8 years. Hannah's composure fractured, just for a moment, just enough for him to see the warrior beneath the scrubs, the woman who'd carried him through hell and never asked for anything in return. "You don't remember me because you were unconscious," she said quietly. "I asked them not to use my name in the citation. I just wanted to be a nurse." Jake pulled her into an embrace that felt less like gratitude and more like recognition, like the closing of a circle that had been open for 8 years across 8,000 miles. Lily stirred awake, confused for a moment, then understanding bloomed on her face. She'd seen this woman save her leg. She'd seen her father cry. She reached out and took Hannah's hand. The general appeared in the doorway, having stayed in Colorado Springs to ensure Hannah's license was not only restored but recognized with a formal commendation from the state medical board. He stood in silence for a moment, watching Senior Chief Petty Officer Hannah Clarke, dressed in scrubs, wearing her trauma shears like a medal, holding the hand of a child, and he nodded with the particular respect that only comes from one warrior recognizing another. "Welcome home, Senior Chief," he said quietly. The words hung in the room like a benediction. Hannah Clarke returned to the pediatric floor the next morning. Her trauma shears were on her belt. The patients in rooms 302 through 310 didn't know that the nurse taking their vital signs had once kept 47 people alive through impossible odds. They didn't know that her hands had held the line between life and death in foreign mountains and in sterile hospital rooms. They didn't know because that wasn't the point. The point was that she was here. The point was that when a child needed someone, someone would be there. The point was that you do not need a badge or a gun to be a warrior. Subscribe to this channel and hit the notification bell so you never miss a story about the quiet heroes walking among us, the ones who serve in silence and ask for nothing in return. Like this video and comment below. Have you ever been underestimated by someone who didn't know who you really were? What would you have done in Hannah's position?